Welcome everybody to this Zoom briefing from the Religion Media Centre, which this week is on the Covid-19 pandemic in India, which has caused an enormous crisis, overwhelmed the health services there, and created a global response from charities of all faith backgrounds and of none throughout the world. And we're very pleased to invite a panel of experts to help us with this. And there are about 6 of you. So I'm not going to read all your names out at the beginning. I'll just introduce you as we go through, if that's okay with you. So we're going to start with Bhavik Depala from Neasden Temple in London. And Bhavik, your temple, which is the largest outside India, has started a big campaign to appeal for funds to help provide medical supplies. I wonder if you could start by telling us something about your appeal, but also tell us the extent of your contacts with people in India and the kind of stories that you've been hearing that have led you to create this appeal.
Well, thank you for having me on. Good afternoon, everyone. So some of the stories we've been hearing, I think everybody's been reading the stories in the news and through their contacts, and for me personally through family and friends, that India is undergoing an unrelenting surge in infections, and this is not even a projected peak yet. And the death toll continues to rise into the thousands. We're reading stories about extreme pressure and shortages of oxygen and critical care beds, and that's why there's a feeling of where, as a country, people who live of the Indian diaspora aren't able to get out to India to support family, friends, loved ones. So one of the ways we can support, and if people are able to support, is through the relief fund, which we've launched, and I'll touch on in a second. And some of the stories I've heard on the ground, one of the temples in the city of Vadodara transformed its assembly prayer hall into a now 600 bed facility, which caters for ICU facilities, the provision of oxygen and PPE for medical staff, as well as accommodation for the medical staff, so they are able to stay on site. And many such BAPS hospitals across India are operating and taking care of those who are suffering from the coronavirus, and to help support the relief work that's undergoing in India. We've launched this appeal, which we started from Saturday evening, and in the joy of others lies our own was a legacy left by His Holiness Pramukh Sai Maharaj, and there's perhaps never been a more critical or opportune moment to embody this noble principle and serve as we can best.
Can you tell me a little bit about how unusual it is for the Hindu communities in India to be called on to supplement the health service in this way?
Well, BAPS has a track record of serving society. When the Gujarat earthquakes happened in the early 2000s, and then Orissa in 99, and we're a community organization who's here to serve and support when at times of crisis. It's one of the noble principles of Hinduism, and it's something that's been left behind as a legacy. In the joy of others lies our own.
You do have your own hospitals anyway.
Yes. So it's there to support the local communities, those who are in need of treatment, and those who may not be able to afford treatment. The BAPS may be able to help those as well. And so it's there to support and serve the local community, seek medical treatment. Absolutely, yes.
Thanks very much, Bhavik. I think I want to turn next to Nilesh Solanki from Sewa UK, it's an international organisation. It's just you're from the UK branch, which is based in Birmingham, and I know that you too are launching an enormous appeal for funds and also for medical things to ship out to India. Can you just sketch in the details of your own appeal and what you're doing in Birmingham and how it's going?
Ruth. Afternoon, everybody. Thank you for having me on. Yeah, it's an appeal which started just over the weekend, obviously with the turn of events within India. Sewa UK has been established for more than 30 years. It's part of a national, international network of Sewa international organizations across 35 countries. It's a not-for-profit registered charity, and it's based on sort of dharmic values, where it's there to serve humanity and through our sort of dharmic Hindu principles and values. We have like I said, an international network, various troops and volunteers on the ground in India. And with this campaign, which was launched on the weekend, we're close to touching £100,000, which has been raised, and focusing our attention on three main core areas of work. One is setting up a digital help desk, which is to enable the right information, verified information for people on the ground, patients as well as the general public, which will help them navigate to proper healthcare and all various centres that have been stood up. The second part is awareness. There's a lot of misinformation out there that we want to try and dispel. Also, what's going on in the media as well. It's hard to decipher the information that's out there and what's real and what's actually going on. Is it across the whole country, or is it just in pockets within the country as well? So giving the right information. And also local teams setting up essential care, and those cares, the actual focus is on budget private hospitals, COVID care centres, NGO engaged in COVID relief, government hospitals and private isolation centres. Now, our primary focus is to supply oxygen, and whether that's oxybeaters, oxygen concentrators, or oxygen cylinders, whether they're full or empty, so we can be part of that whole supply chain and boost the supply within India. So we're working with various companies within the UK to ship those over, working with the High Commission of India, and we are due to ship out various cylinders and oximeters and oxygen concentrators within the next couple of days on a flight which I believe is due to go on Thursday. So this is, bringing together the sort of UK and international diaspora. Just to give you an example, Sewa International USA have raised more than $5 million in a space of 48 hours, and they've just shipped over 2,000 oxy concentrators. So it's a global effort working with various community organizations like BAPS and various others to really bolster the Hindu community, as well as the wider Indian diaspora and the British community as well, to support our efforts in supporting a very aligned country with the British country as well. So I think it's important that we align our efforts because this is a global pandemic, and if we don't help each other, we're not going to, overcome this pandemic.
Just to ask you a question about that, because your day job is with PricewaterhouseCoopers, so presumably you're project managing projects, but on a completely different scale to this. What are the challenges and difficulties of mounting a campaign like this to a really tight time deadline because people are dying?
Yes, absolutely. Look, it's time is of the essence, but one thing we've found in all of this, and I'm sure all the organizations have found, is everyone's willing to help. Everyone wants to give something. Now, whether that's £10 or £20,000, or even if it's a gift in kind, people are coming forward. People are stepping forward to give that. And even from volunteers, our core team task force has grown, over in a matter of hours. And to have those volunteers on the ground in India helps us to build that trust. So when people are donating, they know it's going to go to the right places and it's going to be delivered to the people that actually need it.
Thank you. We have three other guest to bring in, and I wonder if we could widen the discussion a bit to talk about the way that the health service is structured in India, and the place of religions in that health service, and what this pandemic and this crisis is showing us about that. Can I first of all ask Tilak, and then I'll come to you, Pam, if that's okay. So Tilak Parekh, you're a friend of ours, a student at the University of Cambridge, PhD student. Can you sketch in some of the context for us about the role of religion within the health service in India?
Hi, everyone. I think the thing about India in general is that religious organizations and temples, mosques, churches, and religious institutions, they play a crucial role in just the functioning of Indian society. And there's an inseparability and a real collaborative sort of relationship between the religious and the secular in India. And we see, and that's been magnified during the coronavirus pandemic. We see, I mean, historically, religious institutions have played important roles in charitable causes, whether that be in India or abroad, in many countries, even in the UK. But in India, religious organizations are really part of the structure in many ways. Religious organizations like some Hindu temples have huge hospitals that they run, huge schools that they run across the country. And perhaps here, for example, it may not be normal for perhaps a church to run, 1,000 or 2,000 bed hospital, and across the UK, perhaps. In India, there are religious organizations whose perhaps primary objective is healthcare and running hospitals. So there is a real inseparability and a real, religious organizations in India are part of the very fabric of the society in many ways, and they see their role to be to serve society in these ways. So that's why they do run hospitals in many ways. So that's the first thing which I think many people can be aware of, and religious organizations have really stepped up during the pandemic, as we've heard from Nilesh and from Bhavik, that these organizations and charities have converted their prayer halls into hospitals. They've stopped their religious their religious acts of worship and festivals to then cater for healthcare. And I think one of the critical points here, raised also by Nilesh at Sewa UK, is of information. We've heard and seen, even in the UK and abroad, that misinformation, we've all seen them spam on WhatsApp, forwards on WhatsApp, which are grossly inaccurate. And a lot of the times you must understand that for religious people, their religious leaders are perhaps a more authentic and trustworthy source of information than even government ministers sometimes. When their religious leader speaks, it's akin to a sacred being or God speaking. So all of a sudden, when your guru or your swami or your priest says that, okay, don't wear masks, then all of a sudden you don't wear masks. If they say follow the guidelines and do wear masks, you'll begin to wear masks. So they play such an important role in the spread of information. And this, I think, is shown by even last year on the 30th of March, the Prime Minister of India, Narendra Modi, had a video conference with 16 faith leaders to tackle the coronavirus pandemic, which precisely shows the important role these faith leaders play, not only in acts of service, but also in information regarding health. And I've seen some Hindu gurus, for example, even writing that right now your devotion to God is to wear a mask and sanitize your hands. So there is an equation of the secularity and religion at this moment, which we see.
But isn't this a little bit late, Tilak? Because there's a blame game going on in India now, with talk of court action against people for not insisting that masks are worn, and there's much blame being held that the Kumbh Mela gathering went ahead with millions of people there. I mean, is it too little too late from these religious leaders?
Yep, so I mean, there are various sides to this. For example, earlier last year, there were some Hindu gurus, like, for example, Baba Ramdev, who was showing or some Ayurvedic cures for coronavirus, and there are various dimensions of looking at that as well. And people have blamed that for inaccurate information, whereas other religious organizations in India have begun spreading correct information and service from the very get-go, as soon as the pandemic started, giving food tiffins, providing PPE, and yes, I mean the Kumbh Mela has been cited as one of the key causes of the virus spread in India, and that has been a real misjudgment on the authorities' side for allowing such a huge gathering to take place in India.
Are there indications that people have learned a lesson, and in future those large gatherings will be stopped, at least until, you know, India is through the worst, which could be 2 years, some people are saying?
Yeah, I mean, I don't know. I hope lessons would be learned, and we'd hope that people would be more aware. And I think also the nature of the virus is so unpredictable as well. I think there was a patch in India, in fact, where I witnessed at least, where people thought it was done. The cricket matches have started. You know, we saw thousands gather for the India-England test matches and the ODIs even. And there was religious organizations had begun interacting and started, acts of service and worship in person. And then there was all of a sudden a realization that, oh no, this hasn't stopped. And I mean, akin to the second wave in the UK as well. So I think the nature of these things are such, but religious organizations from the beginning in India had risen to the act of service. And then I think there was a patch where people had stopped realizing that the virus had in fact not gone.
Thank you, Tilak. Can I turn to you, Pam, now? Pam Duss, you're the editor at The Lancet and co-chair of its group for racial equality. And you've just joined a group which is producing a report on reimagining India's health system. I wonder, listening to the contributions so far, your reflection on the role of religion in particular in the provision of health service, and what your reaction to what you see in India at the moment.
Thank you. Thank you for inviting me to this really interesting call. Yes, so just a little bit of background about me. Yes, I'm an editor at The Lancet, and I oversee global health. Obviously, ancestrally, I have a very deep interest in India, being Indian myself. And so much of the work that I've been doing with The Lancet has been either in India or with Indians to achieve probably the goal that we all want to work towards, and I think the pandemic brings that into sharp focus, which is for India to have universal healthcare, to really reaffirm the right to health. And that's been very problematic in a country which is so vast and, as you touch upon, so diverse in terms of its socioeconomics and the many different groups, the castes, and populations, the states. I mean, it is so rich, yet it's the diversity that, you know, has over hundreds of years led to the social inequalities and inequities that we see today. And again, the pandemic exacerbates that. In terms of what's been happening in India, yeah, I have a lot of family there, and it's deeply troubling. I've been on regular calls. Sadly, one member of my family who did attend a political rally in West Bengal has COVID now and has been hospitalized. So yeah, we're gravely worried about the situation there. I think fear is a big problem at the moment. Some of my elderly relatives have had the first dose of the vaccine and are due the second one, but are too scared to go out and don't really want to be in big long queues. I think there's also a lot of corruption. I don't think we have. I think another thing that is very unfortunately predominant in India is there is this VIP culture. If you have money, that sort of it talks, and so people can buy things off the market much easily, and that's also led to a rife black market as well in terms of drugs. I think, speaking from the medical health community, which is who I sort of interact with the most. It's very interesting that yesterday, just before I heard this call was going to happen, I was approached by 2 emergency physicians and a pulmonologist working on the front lines in India, and they are just absolutely so frustrated because as healthcare responders on the front line, the official guidelines, i.e. how to treat patients in an emergency crisis, that you have to you have to get going. So just to say that unfortunately doctors do not have the guidelines, the evidence, they're not practicing. Let's put it this way, there's irresponsible medicine being practiced. The system is basically being overrun, not only by demand, but by irresponsible medicine. So a lot of people are not being treated properly. There are very expensive CT scans and lab markets and black market drugs in the absence of basic treatment. So there is a real problem in terms of just initial frontline response by healthcare providers. And this is what I'm hearing. India, one of India's greatest assets and greatest strengths in the world is its community workers and resources. And I would imagine they come from these very religious groups that we're talking about here on the call. And for them to respond as well, there needs to be much more support. There is adequate training and decision support and a whole network, but you know, patients and relatives are having to navigate an extremely difficult process of care, which it varies from state to state. So I guess the picture I'm portraying is probably more negative than we're seeing in the news reports. But I just wanted to give the perspective from the health provider. I myself am working on a commission called the Lancet India Commission on reimagining India's healthcare for universal healthcare, and we want to achieve that over 10 years. One of the best things about this project is that we're going to be drawing on citizens' experience. Those who are receiving healthcare, we want to learn from them what they are experiencing day to day in terms of accessing healthcare and drawing on those experiences. So I think COVID is a perfect example where we're really going to be able to capture that, well, in the chaos, if we can, of this crisis.
Thank you ever such a lot for your contribution there, Pala, and I'm sure we'll come back to you in a moment. But while you were speaking, we were joined by a reporter who's been on the front line of reporting the story that temples and mosques have been turned into hospitals. Saurabh Vaktania from India Today. Saurabh, I don't know if we can see you. We'll return to Saurabh in a minute. Perhaps I can turn to you, Jagbir. Dr. Jagbir Jhutti Johal from the University of Birmingham, can I ask you to reflect on what we've heard so far about the state of the health system and the role of the religion in it, and whether any of this comes as a surprise, a shock from what you see in the media over this weekend, the reporting of the crisis there?
Afternoon. So I suppose when reflecting on the situation within India, and if we reflect on the healthcare system, so you have the private medical service providers, then you have the state-run gurdwaras, and then you have the state-run hospitals, but then you also have hospitals which are run by religious organizations, whether they're Sikh, Hindu, Christian, for example. I think what you are seeing is a tiered system within the health system within India. And I think one of the things that has been highlighted by what is happening now is that within India, communities and people became relaxed at the beginning of this year, thinking that that COVID had gone, kind of thing, that it disappeared, that everything was okay. And with the injections being made available, that things could go back to normal. There wasn't the kind of realization or the responsibility being taken on board by this is a serious thing to say by people in responsibility, to recognize that things needed to be taken calmly and that we needed to look at what's happened elsewhere. And I think with what we've been seeing in the media in the last week or so, what we are seeing is that it's the people on the ground, the communities, who are having to pick up the pieces. And for example, with reference to the faith communities. One of the things I'm reflecting on with the Sikh community is that one of the central messages of the Guru Granth Sahib is of that universal brotherhood and humanism and taking care of each other and recognizing that divine light in all. And how communities have stepped up to the mark. And with Gurdwaras in Delhi, for example, so we normally have langars, which are food, the vegetarian food that is provided to the community. You're kind of now having oxygen langars being provided by these Gurdwaras, where people can come and collect the oxygen for themselves and their family. And the onus there is on these community groups to kind of fill a need where people can get this kind of support without having to worry about cost. That's another important thing, where things like oxygen and medicine, the prices are skyrocketing. With religious organizations, they are doing this kind of free of charge within India, within, say, for example, Delhi. Delhi's been an interesting site for all this to be happening, in the sense that you do have the Delhi Sikh Gurdwara Management Committee, who just at the beginning of this year set up a kidney hospital, and now they're running these oxygen langars for people to come and collect oxygen. But they're also doing the food Sewa. So what you kind of see is the normal kind of selfless service that the community has done and the faith communities have done. They've now had to branch out into the arenas where, in a sense, where there is that kind of state failure. So you can reflect, and I think one of the nice is not the appropriate word to use. It's the coming together of communities to deal with this issue, where we've kind of seen in these kinds of areas a division being highlighted between faith communities, actually where now people are rallying together to support each other, to provide the medicine, whether that's in Delhi or whether that's internationally, to fund organizations, whether it's Khalsa Aid or whether it's the, I'm just thinking about the Sikh organizations or Sewa UK. It's to try and ensure that the needs of the people on the ground are met. That's the first and most important thing that we're all concerned about, and nothing else. And I think one of the other things I think is heartening is how people, how faith communities are uniting. But I was watching some of the news stories with the reference to the funeral pyres and how people of different faiths are coming to support each other when even the dignity of death has been taken, where you cannot have family support, where Muslims are supporting Hindus and Sikhs supporting Hindus and Muslims. It's that the uniting of communities, also in service, in that selfless service, but also in trying to make sure that everybody comes through it.
Thank you. And while you've been talking, Saurabh is back with us. We're so pleased that you found time to join us, because you've been on the front line reporting the situation in India. And I picked up your report on India today, where you'd been into a temple and a mosque, which have been turned into hospitals. I don't know how much of the conversation you've heard in the last few moments. We've been talking about faith communities picking up the pieces now. And we've been talking also about the fact that they seem to be working together in a different kind of way through the pandemic. Can you tell us what's going on the ground? What have you seen? Just tell us what's happening.
So I was actually not able to hear the whole conversation, but the situation on ground is much more grim than we are reporting. Actually, the frontline workers, the health workers, are actually very much exhausted. They are actually running out of resources. They are running out of energy. It's been over 1.5 years, and nobody could have expected that this will come so much hard. And let me tell you, at this time, the community is coming out so strong, helping people. And not just community, but this time people too are coming out and helping. Earlier, I have seen such terrible situation wherein people would just lie on road and nobody would even come to pick you. It was like such a situation. But as for right now, we are actually seeing that people, yes, coming out and helping. But at end of the day, we are seeing that the health infrastructure needs to be good. It needs to be very much upgraded, more focus on healthcare infrastructure. And for the community, like I told you, I have seen this particular mosque in South Mumbai, and it's completely shut due to the guidelines. But it's open. Now it's open for what? They are supplying oxygen cylinders. So what they are doing is they are trying and maximum possible through the distributors. They are finding out oxygen cylinders. Even if the oxygen is available, oxygen cylinders are very difficult to find. Uh, People are actually trying to get from some of the industries in Vasai, Palghar, Boisar. These are the outskirts of Mumbai. This is around 70 to 80 kilometers away from Mumbai. So they are trying to gather all cylinders from those places. And what these community people are doing, they are going to them. They are begging for such cylinders with whatever price they can give. And they are bringing those cylinders. They are filling them with oxygen. And let me tell you, for an example, if 2,000 liter of oxygen you get refilled for around earlier, maybe say 250 or 300 rupees. Now you are getting at 650, 700 rupees, and that too you have to wait for 2 to 3 days. Patient can't wait that much. So this community services is working round the clock. Let me tell you about the Jain temple in Kandivali. So this is the 5-story high Jain temple. They have their kitchen service, they have their meditation room, they have their library. So it's been divided into different rooms. This whole Jain temple now is completely made into a COVID care center. And right now, every patient in India needs oxygen. They need oxygen. It's all about oxygen. But this COVID center, it's around 200 beds COVID center, and it's complete oxygen. So you can understand what management they had. What the community did is they made a proper WhatsApp group. They had all their doctors, they had their all other staff, some businessmen who can contribute, and they made a mini hospital over there. It's such a place that all the 200 patients admitted at that particular Jain Mandir, each and every patient will have their own oxygen pipes at their bed. So this is a huge service which right now community is doing. I would also like to tell you one more example of community service. There's this one community and one businessman who actually suffered from coronavirus 3 months back. His whole family was tested positive. Now, what the major problem is, he did not get food because he could not go out. He did not even know how to make food. So he was facing a lot of problems. What right now he is doing is, now he is making sure that every day he supplies around 400 food packets to coronavirus patients who are isolated at self-isolation. So these are the services which I've been seeing from, these are not some government institution or some big organization. These are the community who are actually coming out and helping people in such situation. This is really a positive thing which I'm seeing in this particular second wave.
Thank you. I've got one more question, and then if anyone has a question for you, do come in after me. So one issue that's been raised is that this is breaking down the religious boundaries, because people are helping one another, particularly with the funeral pyres. Is that your experience too?
Absolutely. Now, I would like to share you few incidents because there is a population problem in India, and now most of the family members do test positive. So there is one family which was completely into home isolation. Some of the members were very serious. But one of the family members died. They were from the Hindu community, but the Muslim community came forward. And let me tell you, they did not just take the body to the funeral, to the crematorium, but they also perform the final rites wearing the PPE kits. This is big. And not just, I'm not talking about one particular community, people from all the community, be it Christians. I'm telling you, all major of Christian schools have been converted into COVID center. So all people, or be it of any religion, all are coming forward in whatever way they can. They are helping each other, and this is how this is the positivity. But let me tell you that there are a lot of problems which people are facing. But living apart, the community are doing great service. Absolutely.
We're getting some absolutely remarkable insights here, I think, and as we just heard firsthand reporting on this disaster. But one particular question I wanted to ask: where the authorities have been reluctant to intervene and go against the advice or practices of spiritual figures, religious figures. And we've had one example with the Komela, and maybe there have been other practices that have gone ahead when on health grounds perhaps they should not have been. Why do you think that's been the case generally? Is there a particular reason for that, do you think, that the authorities would be reluctant to do so? And just one other question while I'm on, which is that very often, as many of you will know, there's quite a bureaucratic obstacle in giving funds for charitable work in India from outside India. It's quite a common thing. Is that being experienced now, do you think, or are those obstacles not there at the moment? Are they being suspended? Is it easier to help?
Can you hear us, Saurabh? Perhaps I can ask Nilesh to take that second part of the question on the difficulties getting supplies into India.
Yeah, I think there have been difficulties, especially with all the red tape and sort of bureaucracy, etc. But I think working with government officials just on the weekend, various government departments as well as community leaders came together to get a shipment out straight away to India, and that was quite successful. The shipment from USA for Sewa International will be reaching in the next couple of days. But I think it's a time for governments to cooperate, and whether it's China, USA, or UK, we need to have any red tape or any previous issues between countries to be put to one side when it comes to such calamity, and pandemics. So I think we need to really work together shoulder by shoulder, and especially the neighboring countries, around India. Need to show that solidarity because this spike or this sort of emergency may have hit India today. It hit the UK a few months ago, and we were in a state of panic. It's hitting the USA. It's going to hit other countries yet to come. Wave 2, wave 3, and it's the global community, and that's a key tenet of our Dharmic values, which is. In Sanskrit, we say Vasudeva Kutumbakam, which is the whole world is one family. And this is something that we all need to bring together. And like Tilak and others have said, it's a matter of breaking down those religious barriers. When we serve, we've got Sewa International in India, have got 500 pop-up sort of COVID centers now, and they don't care what religion you come from. We want to serve the public. We want to serve whoever comes through that door that needs it. And no one's going to be asked about their caste, creed, or color. And we're just serving humanity, and that's the purpose, and that's the ethos that we follow.
Thank you. Saurabh has rejoined us. I don't know if you can hear us, Saurabh. So I don't know if you heard, there's two parts of Mike's question. The first was how you explain the religious gatherings. I'm paraphrasing, Mike, you'll tell me if I've got this wrong, how you explain the fact that the religious gatherings were allowed to take place, what was going on there. And the second thing is the willingness and the ability to get aid into India despite difficulties.
First of all, this maybe the religious gathering or the political gathering at the first hand, it shouldn't have happened. When the coronavirus is at peak, and maybe at that particular area the cases were not been showing up, but the cases at other parts of our country were coming up very high. Let's just take an example of Mumbai itself. I remind when this religious gathering were taking place maybe around a month back, Mumbai had already crossed cases around 5,000 to 6,000, and when it was at peak, it was at around 12,000 to 13,000 cases. So the timely restrictions were not applied at all. Let me make it to you very clear, because this at particular this religious places, there were special trains which were been run, which were been running to those places, and for the public gatherings of the politicians. And this was the most important part. Let me tell you, that should have been stopped, because it could have averted cases by way far. Now, in particular, West Bengal, if I tell you, every third person is getting tested positive for coronavirus. I have many of my relatives who stay over there. They say they were not worried about it when cases were coming so high at different parts of our country. In West Bengal, nobody cared to have a testing facility properly. The mask was not compulsory. Let me tell you, after 5 to 6 phase of election got complete, after then there was an order which made that mask should become compulsory. So we see at many places there are a lot of loopholes. Maybe the restrictions could have been placed at a very early stages. There could have been proper guidelines. So definitely the cases wouldn't have been so high. And there were many experts who were clearly saying that after the first wave, there will be a second wave which will be coming. So you should have been prepared for it. You got around 7 to 8 months for the preparation. So we were actually running behind the time. So now it's actually at peak. In Mumbai, I'm saying that more COVID jumbo facilities will be made in a month or so. They will be having around 5,000 beds or so. They are also making around 16 oxygen plants. So it could have been done earlier, so we couldn't have seen such a worse ground situation.
Thank you, and I know you just put in the chat that you've got other duties as well. So thank you for your time, Saurabh. If you have to go again,
what happened is my other colleagues in Mumbai have tested positive. We have only me and another reporter who is working on field. The rest all are positive. Their family members, some are positive. So situation is such. I sometimes feel so helpless. I can't even. Sorry to put in my personal, but sometimes I can't sleep when I can't help people. We try all possible ways that somebody needs remdesivir injection, somebody needs oxygen bed. The phone keeps ringing, and sometimes it's so helpless. For hours you can't do anything. So this needs to go away. Like we have seen enough of it. Like it's over a year and now.
Well, all of us wish you well reporting the story. I saw you on the front line in the hospitals with a mask. You take care, Saurabh. Don't. And thank you very much for joining us. You stay as long as you like, just in case you have to go. Could I bring in Mukesh Azad? Thank you, Mukesh Azad from Food for Life. I'm sorry we've kept you hanging on and haven't come to you yet. But I wondered if you would like to pick up what Sarah was saying earlier about the difficulties in providing people who have COVID with food because they're too scared to leave their houses. So there's a risk of starvation now. Can you tell us something about the work that you're doing and the situations that you've come across that have needed your help?
Yeah, so it was 22nd of March 2020, which means last year. I got a call from one of the slum, and so she said that she is left with only two options: either to sell her body or commit suicide with 5 children. Yet another woman from the same slum, she called me and she said that She has been living under constant pressure and mental trauma because she had no idea when the sacks would be demanded by the landlord as the rent was not paid, as this has been the case previously. So hearing stories like that, my heart started burning within me. I'm an ex-Vodafone, so I tried to mobilize Vodafone. It did not work. Then I tried to mobilize the local government. It did not work. And then I tried to mobilize my friends and my faith community. I come from Christian background, and it worked. The Lord was mobilized through his faithful people. So in last 1 year, to be precise, 379 days, we provided 1.17 million meals, which means 4,000 plus meals every single day to these slum communities. And since last week, I had been hearing other stories about oxygen shortages, and a lot of people are dying from my law schools. Professors have died. And then some of my family members got COVID, and people are struggling and they are dying on the road. So we got involved into something called now, one of, I think, one of the panelists, she said, langar, oxygen langar. So we have not started an oxygen langar, but we are doing our level best. I'm just the one person who is at the core, and I do not have any charity. I come from the corporate background, but I have got friends who have been very faithful in their giving. People in the US, in the UK, and my wife, she was also able to mobilize people in the US. She's an American. So in fact, we went to the point where she had said last year, she sold one of her necklace, diamond necklace that her mother gave for the feeding program. And right now, I got a call. There was one person, my own cousin brother's wife. She's 44-year-old. And since last 2 days, she has been struggling with the oxygen. And somehow we were able to find oxygen concentrator for her. But it was working for past 2 days, and it became little bit hot. So what had happened, the doctor swapped her oxygen concentrator with an old woman. This old woman was about 67 or 68-year-old. This old woman had oxygen cylinder tied to her mouth. So that was swapped with my sister-in-law. And within 15 minutes, this old woman died.
We just lost you in that last bit, but thank you for
Because
joining us.
oxygen.
It's a difficult line. Yeah, you keep dropping in and out, but thank you. I think we got most of that. Thank you very much. Thank you. Can I just ask perhaps Jagbir Jhutti Johal to kind of reflect on Mike's earlier question about the reasons why that the religious festivals go ahead, and how difficult it has been to get the message across that this is a very dangerous virus?
I suppose if we reflect on what happened within the UK, politicians and faith leaders came together and said, right, this is what's happening. Places of worship are going to be closed, or it's going to be private prayer only. So there was a consensus and decisions were made together. Reflecting on India, I think that's very difficult to achieve because of the diversity within the faith groups and everything. And I might be being cynical here and getting myself into trouble by saying this, but I think there has also been a lack of really enforcing the rules on religious faith communities from governments or state governments, not to hold large events because there are certain elections coming up and it's a vote bank situation. So that might have also played another role or factor into it, where these difficult decisions weren't made and enacted. And we're now seeing the repercussions of those. So that's an issue. And I think one of the things, I think Michael asked about the issue about charities and funding and whether they would encounter difficulties. I don't think any charity in this current context will find any difficulty. Barriers will be removed and it will be ensured that money and resources get brought in. But what I do want to bring up is one of the charities that is working on the ground within India at the moment is Khalsa Aid. But if we just reflect back a couple of months to the farmers' protests, and then the Indian government defining them as being a terrorist organization and they're questioning their funding and everything, you have to ask these kinds of questions and probe what the agendas are. So I'll just leave it at that. But I do think one thing I do want to highlight is I think in this current context, it is the faith communities that are internationally, but also nationally, that have come together to really now address the situation. And it's them, and I think it is the people's power here working to try and address all the issues, and trying to meet demand, whether it's food or whether it's oxygen, etc.
Thank you. I think that might be, I mean, we could carry on talking about this. There's so many excellent contributions on the call for a long time, but our Zooms are only an hour long. So I think that rather neatly draws things to an end. I can certainly help all of the panelists get you keep you in touch with one another if you would find that helpful, and send your emails to each other, because your areas of work do align so much. So thank you so much for joining us and for your insights into this, and do keep in touch with us. I'm sure we'll return to this, and let's hope the picture improves in the next few weeks and months. But thank you again for joining us. Stay safe, everyone. Bye.